The germ is one thing. That's nature. That's nature. But the negligence and refusal to act is another.
Now, tell me, what will you be preaching on Easter Sunday?
You know, I'm wrestling with that right now. I'm wrestling with the text, David, and it's an interesting piece. It says, while he was on the cross dying, that other people got up out of the graves. And the sense in that story is that other people sacrificing sometimes causes us to stand up. And so when we see these healthcare workers, for instance, on the front line, and these grocery workers, that their sacrifices, and some of them dying, is actually causing the consciousness of this country to stand up. I want to talk about how this moment of pain, just like other moments of pain throughout history, slavery, segregation, sometimes in the midst of pain, something very unusual happens, and that is the very moment that people get up and nothing is the same afterward.
In some sense, you think it's possible that everything that you've been trying to organize in recent years, a poor people's movement that is inspired by Martin Luther King Jr., particularly in the last years of his life, could get some impetus from the tragedy of the pandemic and the politics surrounding it?
I do. You got 140 million people poor and low wealth. You got 62 million people working without a living wage. You got all these people uninsured and underinsured. And now this pandemic comes, and what you could kind of hide before, you can't hide now. And in addition, David, what we're learning is you can't isolate the germ. So you can't write a bill and you don't provide health care for everybody and think the germ is just going to stay over there with the people that don't have health care. You can't write a bill like they just did and say we're not going to cover 11 million undocumented workers and think if they catch the virus, it's going to stay over there. So there's something that we are learning. This pandemic is teaching us a hard lesson. We have a saying, everybody has a right to live. We've changed it now. Everybody has a right to live. If they don't, we don't. For instance, if a worker right now is sick, they don't have sick leave, they don't have insurance, that they feel the symptoms, they may still go to work, the essential worker, go to work, because they got to choose. Do I eat now? Do I go to the hospital, maybe find out that I have the virus, get put in the hospital, and then go and then have this large medical bill afterwards? People shouldn't have to be making that choice. But in making it, particularly if they make it to not go and ride it through, guess what? They put everybody at risk who comes and gets that food or comes in that restaurant or they're around.
Do you feel that you have a champion for the causes you're talking about, for healthcare, for income for the poor, and equal access, and all these things that you've been discussing for years and years? You feel you have an ally in Joe Biden?
Last night, he was talking about the heroes of the essential workers. He was saying, we are seeing the soul of America. And I'm writing a tweet now, I haven't sent it yet, to say, okay, if we are seeing the soul of America in these essential workers, when are they going to see the soul of America? In other words, if they are essential, when are we going to treat them like essential? If they did not hesitate in going in to try to save patients and putting groceries on our shelves and cleaning our bedpans and handing us our food, then are we ready as America now? And is he and others, are they ready to champion that we cannot hesitate making sure now that they have health care? He has a chance this moment, even to say, you know, before this thing happened, I was still talking about just expanding Obamacare. But in this moment, I'm going to adjust my position. I got to adjust my position. I believe everything now can shift because this moment of possible mortality for all of us calls us to a new place.
Reverend, I think that your argument with someone like Donald Trump is not merely ideological, although that's a huge part of it. It also has to go to a sense of character, a sense of empathy or the lack of empathy. As a spiritual leader, how do you look at a person like that? What do you make of him?
When it comes to a Trump, or when it comes to a George Wallace, we look at policies. You can say all day what you are, But your policies is how, as a spiritual person, as a person of faith, we are supposed to examine what you do. So, for instance, the last week of Jesus's life, he was talking like this. Matthew 23, he said, "Woe unto you all that go through all of these religious things, but you leave undone justice and you leave undone mercy." Jesus said, listen, when I was hungry, did you feed me? When I was naked, did you clothe me? When I was sick, did you care about me? When I was in prison, when I was an immigrant, what did you welcome me? He said, inasmuch as you do it unto the least of these, you've done it unto me, not just to them, to me. So what you do with a leader is you take those policies and you lay those values on top of that policy. And you say, if those policies don't care for the least of these first, the poor, the sick, the imprisoned, the immigrants, if those policies don't line up, then it's not of God. It's not right. It's immoral.
It is not lost on you in North Carolina, and it's not lost on me in New York, that the rate of infection among African Americans in counties that are majority Black is 3 times higher than in counties where the majority is white. The rate of death, the mortality rate, is 6 times higher in Black majority counties. What does that tell us?
It tells us that the structural realities and inequalities that existed before this pandemic, that put people in a position where they had the least amount of health care, the most amount of pre-existing conditions, because of the way in which the things that could stymie those realities are meted out in such racially divisive and unjust ways. In a pandemic, it then gets exposed. This pandemic is saying, though, to us, something that Dr. King said a long time ago. We either learn to live together as brothers and sisters, or we're going to perish together as fools. So while it may be 6 times higher, guess what? All of those people that get overly infected, those percentages, they hurt the Black community, but it also keeps the pandemic alive in the larger community. That's the difference with a pandemic. Some other forms of racism, you can kind of keep it isolated. You know, you can keep that racism kind of over there in that community or that housing area, or you can redline that area, or you can voter suppress that area. But a pandemic is different. If you allow it to spread like that and don't address the structural realities that put people in what we call predisposed, that make them predisposed, then it actually allows the pandemic to have a greater foothold in the larger society. So this is the question I'm asking people now, and I'm wrestling with myself because I have my own immune deficiencies. If you knew that you had 48 hours of breath left, because that's real for people who get this disease, that if they contract this disease, in 48 hours, they could be on a ventilator, no longer breathing under their own breath. If you knew you had only 48 hours of breath left, what kind of world would you use that breath to fight for? Would you fight for a nation where people at least can be guaranteed that their water's not going to be cut off, that they have a living wage, that they have health care, that they have basic affordable housing? What world, what kind of justice, what kind of love, what kind of truth would you fight for if you knew you only had 48 more hours of breath left?